What are the three common causes of lower back pain, and what are the three common causes of neck pain? Number one is arthritis. What does arthritis mean? Arthritis literally means joint inflammation. Any sort of itis, appendicitis, dermatitis means inflammation. Itis means inflammation. Arthro means joint. So what does arthritis look like in the lower back? Here's what they see on your x-ray or your MRI that shows that you have arthritis. This is the joint. So you have a bone in your back, bone in your back. Most common level affected, L4, L5. If you're American and you're over the age of 55, there's a 95% chance that you have some sort of arthritis going on at L4, L5. So this is the joint. Your disc is right here, bone, bone, and then you have your spinal cord running down the back. This would be looking at a person who's facing this way from the side. Okay? So we have a joint right here. What happens with disc degeneration, that space shrinks down. That creates a smaller space right here, which is also known as stenosis. That may show up on your x-ray or MRI as well. That closes down. That creates a problem because there's a nerve root that comes down, and that forms your sciatic nerve. That space closes down. Creates a lot of problem and a lot of pain. What we want to do with that is open that space up as much as possible. If we don't, you get long-term inflammation, which results in arthritis. This is the person who, when they're at the grocery store, they're leaning forward on the cart because they have pain standing up straight or walking for long periods of time. All successful treatment there, whether it's traction or hands-on or exercise techniques, what that does is open up that space. Can you be 18 again? No, you're not going to be 18 again. But there is a lot that you can do to open up that space and keep the inflammation away as much as possible and prevent it from coming back in the future. Next cause, herniated disc. Your disc is right here. There are three levels of herniated disc that are common on an MRI. Number one is a bulge, where the disc will push out the back and you'll get a little bulge right here. And then you have the nerve root coming out, the nerve branch. That bulge can eventually become herniated and put pressure on that nerve root. That creates pain that runs into your groin, into your buttocks, down your leg, and possibly into your feet. In the neck, if you have a herniated disc, it creates pain into the chest, into the shoulder blade, and down into your arms and possibly your hand. That's a herniated disc. You can also get a ruptured disc, and usually that requires surgery because now there's nerve damage involved. Very, very rare unless there's some sort of high-speed auto accident or a person falls off a 4-story roof and lives to tell about it. Can we heal that? Absolutely. You get this material to go back where it's supposed to, and that can heal, and it can stay that way long term. The third cause of lower back pain is the pelvis, or for neck pain, it's the rib cage. It's the same exact concept though. If this were a tabletop and you had a stack of 5 blocks, and you move this block, how would it affect the other blocks? Minimal, if at all. If you move this bottom block, the foundation, what does that do? If you move this block a little bit, it's going to affect everything else above it. Your pelvis works the same way. So if this were your spine and you were looking at somebody head on, and this were L5, L4, you'd have your tailbone right here, kind of looks like this, your pelvis comes around, and this would be looking at somebody from this shot. Many times, what will happen is somebody has an L4, L5 disc herniation, or they have L4, L5 disc degeneration, stenosis, some other big fancy term that means they had an x-ray or they had an MRI and there's a problem right here. Many times that person will have an underlying problem within their pelvis. If we only address this, they'll heal temporarily. If we address this and address the cause of the problem within the pelvis, they'll heal long term and they'll stay better. What does that look like? This is the person that when you ask them where their pain is at, they say that they have pain right here. True sciatica is pain running down the back of the leg. A person with a problem in the pelvis that is getting inflammation on their sciatic nerve, they say that the pain wraps around to the front of their leg or that it stays on the side. They also complain of leg heaviness. The common activities that will cause problems are rolling over in bed, crossing one leg over the other, standing with the weight shifted, or getting in and out of a car. A person who's doing that and is having pain, especially beside the tailbone right here, most likely has a problem within their pelvis. They can address that, very easy to do, help them to move in the way that they're supposed to move within their pelvis and then stabilize it long term. Also very common among runners and women who are pregnant or have just delivered a baby, especially if they have a toddler. They're toting the toddler on their hip like this, and that creates a lot of problems within the pelvis. Get it to move the way that it's supposed to, retrain the muscles in the stomach and the back to prevent it from happening again, and that person can get better and stay better long term.